Hello and a very good afternoon to all of those who are watching me live. I'm Neha. India has crossed a grim milestone of 5 million cases and is at the second spot when it comes to the worst affected COVID countries in the world. Even though the numbers are rising, the government stated that India learned from the experience of other countries reeling under COVID-19 in terms of death rate. ICMR Director General Dr. Balram Bhargava hailed India for taking early measures to prevent the spread of COVID-19. He said that the country was able to distribute the COVID curve due to very effective lockdown. He also said India learned from other countries and avoided the huge peak those countries witnessed in terms of death rate. Dr. Bhargava also said, and I quote, during the peak in Europe and the US, there were huge numbers of mortalities. We took learning from that and were able to distribute the curve in such a way that we did not have those deaths. This was attributed to the lockdown. We were able to distribute the curve and did not have a huge peak at all. That's what the doctor had stated. Do remember that over 82,000 people have succumbed to COVID-19 in India so far. In fact, the statement comes in the backdrop of AIMS director Dr. Randeep's statement that India is already witnessing a second wave in a few areas. Now, to give us some more insight to it, joining me over the phone line is Dr. Prateek, who is an infectious disease expert. Thank you very much, Dr. Prateek, first of all, for talking to Newsline. Do tell us, sir, did lockdown really help in bringing down numbers? The fact is we are at the second spot, as I mentioned, when it comes to the worst affected countries. We're also reporting exponential rise in cases with each passing day.
Hi. Yeah. So I would agree with the ICMR saying that we have successfully distributed the curve due to the lockdown. What happened due to lockdown, the number of, the exposures reduced. So that's why the transmission chain was slowed down. Though we have seen the surge in the number of cases in subsequent times, but yes, the transmission was less during that time, and obviously the cases did not surge due to the lockdown. However, what it helped in other way is we got better prepared, because in other cases, in other countries, there was an immediate surge in few weeks or months, and probably they were got less prepared. That helped it in terms of preparedness for us. So all the healthcare workers or the medical fraternity was ready to handle the situations. They got time to get acquainted with the COVID protocols. Treatment was more clear by the time the tide hit India. And same thing about the supplies, the medications, the PPE, everything was available on time.
Okay.
We didn't face a grave shortage of these equipments and medications. Mm-hmm. And obviously we were more wiser in terms of treatment by the time we saw a surge in the number of cases. Mm-hmm. So yes, it definitely helped in reducing the peak and spreading it out over a time so that we can respond in a good way.
All right. So, Dr. Prateek, Dr. Bhargava also spoke about the possibility of reinfection, saying it's very, very rare and not a matter of serious concern. But having said that, we had cases, in fact, in Bengaluru, where people got reinfected within a month.
Yeah. So, yes, I would agree that there are chances of reinfection. But again, I would reiterate that it is a very, very rare instance. So now, so far, we have seen lakhs and lakhs of cases, and the number of reinfection we are talking at the moment is still around 10 maximum. Mm-hmm. I mean, there are a few case reports again from India today. There were some news again that a few in Mumbai and some in other parts of country have been reinfected. So yes, the numbers are there. But again, when you talk about people first infection in lakhs, I think this is a very, very small number to be, to panic at the moment. However, the message which has to be very clear is people should not relax after the first infection or any time. Mm-hmm. The first infection doesn't give you immunity forever. Okay.
So it does mean that, I'm sorry to interrupt, it means that if, suppose I'm COVID positive, I can get reinfected. Is that what you mean?
We don't have enough information about that. So if you have recovered from COVID, there is potentially a possibility that still there is a chance of reinfection.
Of
but
course, after
it
recovery.
doesn't happen. Yes, after recovery, but it is not a common phenomenon. It's very, very rare. Important message is, after you recover from COVID, you should not stop practicing the basic preventive measures like hand washing, social distancing, universal mask use when you are outdoors. So these are the important messages here. So we should not panic. At the same time, we should stick to the basics and continue doing these basic measures.
Right. So, Dr. Pratik, is India doing better in comparison with other countries when it comes to the mortality as well as the recovery rate?
Yes, because you can see the number of deaths in India are much lesser, and recovery rate is also a good number.
Well, isn't it also because many people who are testing positive, of course, are from the age group between 18 to 35? So they have more chances of recovery.
That's true.
That's one of
the countries where you have elderly population more percentage, or those with comorbidities and other things, the mortality rate has been high. However, in India, because there is a lot of young population in India, the mortality rate is lesser. So, I mean, the risk at the baseline for the severe disease is very less compared to the elderly population.
So, the younger population is getting more affected than the elderly. Am I right?
No, that's not the same way. I'm saying that if a young person gets infected, the chances that he will recover without the problems is much higher than the elderly.
All right.
Chances of infectivity are more or less equal in both age groups. The disease occurrence, whether it's a mild disease or severe disease, is the what depends on the age.
All right.
So if it's elderly, they are more likely to have a severe disease than the young people.
All right, all right. So, Dr. Pratik, another very important question when it comes to the handling of crisis is the testing. And of course, are we testing enough? We certainly have made an improvement, but is it still enough?
Yes, I think government has put in a lot of efforts in making the tests available. And I think it's people's responsibility also, same time, to come up if they have any symptoms, not to neglect and get themselves tested, so that we can arrest the further chain. If they don't report, obviously we can't test, and we cannot prevent the spread. Because it may happen that you may get fever and other symptoms suspicious of COVID just for a couple of days, and you can recover. If you don't test and report, it may happen that you may be still infective, but you will not follow quarantine or isolation precautions, and you may be spreading the infection. So it is very important. If you have symptoms, go into the isolation, get yourself tested, follow the isolation as per the illness, and take care.
All right. So, Dr. Pratik, lastly, what's your message for those, who are in a state of panic? Of course, taking preventive measures is as of now the only way to deal with the pandemic. But what's your message for all of those who are, perhaps not stepping out of home, of course, doing a great deal of work at home, not stepping out, making sure that they are safe as well as they're keeping their loved ones safe as well. So what's your message for those people?
I would say this is a real situation. There is panic. Getting panicky is not going to help you. So keep your calm, because if you are panicky, you are going to make more mistakes, So follow these precautions, wear your mask properly, practice your hand hygiene, and stay safe. Try to stay indoors as much as possible unless it's really necessary to get out. So these are the core messages I would say. And even if you get some symptoms, try to report it at the earliest so that appropriate measures can be taken.
So, Dr. Patil, before I let you go, lastly, when do you think we'll get to see a vaccine, COVID-19 vaccine finally?
That's very difficult.
It would be difficult to say, I understand, but what according to your medical expertise?
Maybe end of the year 2020, let's hope for that.
All right. All right. Thank you so very much, Dr. Pratik, for joining me with all of those details. Well, there you heard Dr. Pratik himself saying that if at all you had COVID and you have recovered, chances are that you can get reinfected. That clearly doesn't mean that you cannot take all the preventive measures put in place. Please take care of yourself. Always remember, staying home and staying safe is the only way to deal with the pandemic as of now. With vaccine a distant dream, we still do not know when the vaccine will come out. Of course, there are several countries in the race to finally, bring out a vaccine for COVID-19. But when can that really happen? That's something that still remains to be seen. Take care of yourself as well as your family members. Stay safe, and do remember, I've been saying this throughout, if at all you have elderly at your home, take extra precautions. Thank you so much for watching me. If at all you like this video, do not forget to subscribe Newsline YouTube, like us on Newsline Instagram, Facebook as well as Twitter. Take care of yourself. Stay safe.